Hello, everyone. This is Rada, and welcome to FMA 2 Part 3, where I will be taking the evaluation framework that I developed in Part 1 of FMA 2 and applying it to one of the social marketing programs presented by one of our classmates. In this case, I will be evaluating the Unang Yakap campaign using the Triple R evaluation framework. To give you a glimpse of the evaluation framework before I begin, these are the seven components that make up the framework, and for each component, there is a corresponding point system through which I will be evaluating these components as they are applied and observed in the social marketing program at hand. So these are the descriptions for what each component will be all about. And again, here is where I will be diving deeper into the social marketing campaigns and see how well this was applied. So to start, we have our first component, the relevance to target issue. The Unang Yakap campaign, as I can observe in the relevance to target issue, I can give this component 15 out of 15 points. This campaign directly addresses newborn mortality, infection, and poor early life care, which are critical public health concerns in the Philippines. It is based on the Essential Intrapartum and Newborn Care Protocol, an evidence based intervention developed with the World Health Organization. The program targets key risks such as hypothermia, infection, and delayed breastfeeding through immediate post birth interventions. The idea behind the campaign alone is already a very clear relevance to a pressing issue in the Philippines, and that alone merits it a perfect score in this component. For target audience reach, I gave this program 14 out of 15 points. The Unang Yakat program is institutionally mandated in both public and private birthing facilities nationwide through a Department of Health administrative order. It has been implemented since 2009, meaning that a large proportion of facility based births in the Philippines are exposed to the intervention. However, its reach may still be limited in home births or underserved areas without access to skilled health professionals. So that is where I find this particular component lacking. For communication effectiveness and application of marketing mix, I gave this program 14 out of 15 points. The Unang Yakap campaign communicates clear, simple, and actionable set of four steps in this campaign. That is drying, skin-to-skin contact, delayed cord clamping, and early breastfeeding. The four P's or marketing mix of this program are as follows: the product being the social product of safe newborn care and improved survival. The price for this campaign was kept to a minimum where interventions are low cost and integrated into routine care. The place for where this campaign may be acquired is already delivered in hospitals and birthing centers. For promotion, this was mainly communicated through health professionals and national campaigns. The simplicity of the steps in the Unang Yakap campaign enhances clarity and adoption, although a broader public facing communication campaign should be strengthened. For engagement and participation, I gave it once again 14 out of 15 points. The program promotes active maternal participation, particularly through skin to skin contact and early breastfeeding, which require direct involvement of the mother, the primary audience of this campaign. It also encourages behavioral change among healthcare providers, ensuring adherence to standardized practices, which again serves the secondary audience of this campaign. However, participation is largely provider driven rather than community driven, which slightly limits broader engagement. So that is where I think this program can further improve. For behavior change and outcome effectiveness, I gave this program 19 out of 20 points. There is strong evidence that Unang Yakap leads to improved health outcomes, including an evident report of reduced risk of infection and hypothermia, increased breastfeeding initiation, and improved newborn immunity through colostrum intake. Early breastfeeding alone is considered a life saving intervention that protects against diseases such as pneumonia and sepsis. Now, with the Unang Yakap program, this was fortunately addressed, leading to a well reported behavior change as outcome of this program. When it comes to the efficiency of implementation, I gave this program 9 out of 10 points. The program is highly efficient because it uses existing health systems and personnel to carry out the campaign. It requires low cost interventions such as drying or skin to skin contact. It is also integrated into routine delivery practices. All of these minimizes the additional resource requirements while still maximizing impact, which is what efficiency is all about. Lastly, when it comes to sustainability and continuity, I give this program 10 out of 10 points. Unang Yakap is embedded in national policy and standard clinical protocols, which already ensures its long-term continuity. Its alignment with global health standards, such as the World Health Organization, backed by the EINC, further strengthens this program's sustainability. However, still, sustained success depends on continuous training and monitoring of healthcare providers. So, this is hopefully maintained over time. All in all, this program has garnered 95 out of 100 points, which fits in the bracket of excellent, highly effective, well designed, and impactful program. The Unang Yaka program stands out as a highly effective, evidence based public health intervention. Its strengths include strong scientific foundation, nationwide institutional implementation, and proven impact on newborn survival and health. Some improvements could include expanding reach to home births and underserved areas, as well as strengthening community level engagement and awareness in doing so. That ends my evaluation of this campaign. Here are my references, and thank you so much for listening.